I think being able to communicate what your needs are, what your lifestyle is, where you are at financially, those are things that sometimes get lost in the kind of the role of a patient getting a treatment plan and then proceeding with treatment.
A cancer diagnosis can be shocking, and the cost of treatment is not the only financial consideration. Recently, I spoke with Dr. Kamal Golla, a urologic oncologist, about how to approach the financial aspects of cancer treatment from a holistic point of view.
I think a couple buckets that I always try to go through, and generally, regardless of the type of diagnosis of your oncology journey, these are all really important elements. So one of the first ones that I always want patients to really have a good grasp on is understanding their diagnosis and prognosis. It's crucial. I mean, absolutely crucial to have a clear grasp of, what your diagnosis means and what's the prognosis. And obviously, this invariably will change based on the type of tumor you have or the type of cancer you have, the stage of your condition. There's always the risk of what we call progression or the disease advancing versus how treatable the disease is. And all of these kind of fall under that big umbrella of diagnosis and prognosis and really are sometimes the first key steps in even understanding the treatment plan that you have in your hands. Another big bucket there is, when we're kind of diving into the treatment plan itself, is understanding what you're at risk for in terms of experiencing symptoms and side effects from the treatment, right? Different treatments come with different timelines for when side effects might appear. So we always tell the folks that we're helping navigate, knowing this can help you prepare mentally and physically to know when the toughest parts of the treatment might be, or when you can kind of hope to expect really feeling better and going back to some of your normal activities. So, I mean, I think those are things that we always start with. And I think, you brought up first, the other areas are time management, really building out great support systems. Having a strong support network can make a world of difference, especially as they navigate the emotional ups and downs of, dealing with the diagnosis, lifestyle adjustments, right? Treatment can affect your energy levels. So you really have to think about your appetite, your overall well-being. So really thinking about how you're going to manage these changes. These all really come with the treatment plan. And it at times can seem overwhelming, but thinking about this holistically really helps prepare the patient. And then I won't forget about the point that you originally brought up, which is financial planning. I think this has always been really near and dear to my heart in terms of really addressing what we call this idea of financial toxicity, right? That the term that essentially the medical debt or the costs of paying for care, and it originally started in the oncology space, can have what we call toxic or really negative effects on how you live your life. And it might be direct effects, like you don't have the money to pay for a particular medication, so you perhaps just skip filling that medication or don't take it. Or it might be the psychosocial effects of dealing with medical debt. And it is obviously a very hot topic right now among policy folks, among individuals like myself who are building care models. I mean, the numberings are frankly quite sobering. There are a lot of cost contributors when we think about this space beyond the immediate medical bills. There's the costs of medications, travel to treatment centers. Sometimes people need home modifications, right? All these things that really can pop up once you have this diagnosis. And so financial planning, understanding what your out-of-pocket costs are, understanding your insurance benefits if you have a diagnosis like this. All of these are super critical when patients are faced with a diagnosis. And so I always recommend making sure you're very transparent about this with your family members, if you have a financial advisor or a social worker that can help you. There are a lot of resources to help navigate these expenses. There's there's grants, there's community resources, there's financial aid, there's a better understanding of your insurance coverage, but it starts with just planning it and really talking about it. And so, again, a lot of support that goes into helping patients deal with these.
Something else I think that is important to bring up is that it's not just the cost of treatment or the cost of whatever it is that goes along with the treatment. You might be missing out on income, right? If you're taking time off from work to go get your treatments or to recover from those treatments, or depending on, the severity of your disease, you may or may not be able to work at all. Do you have any thoughts on how to kind of prepare from that, not just for more money going out, but less money coming in?
I think that's a great question, and actively one we think about. And again, I think it starts with communication with your physicians about, who's currently, supporting the family financially, right? What does that job look like? Are you salaried? Do you work hourly? Have you already missed significant time because of, your disease burden or your cancer diagnosis that you're worried about your job and particularly losing your job? Like, all of that actually is very meaningful inputs to help, potentially even change your treatment plan in a way that supports your ability to at least maintain financial stability the best we can. And I'll give an example. One of the types of cancers that I commonly treat, although surgically, is prostate cancer. And prostate cancer, there's a number of ways you can treat prostate cancer. And patients dealing with prostate cancer have a lot of options, right? They've got options where they could get radiation treatment, they could get surgery. Depending on the aggressiveness of the prostate cancer, you could potentially closely watch it with imaging or blood tests. So in some cases, we can actually alter the number of fractions or number of treatments of radiation that are delivered. And sometimes that is actually a consideration when we're talking about treating an individual with prostate cancer. And so what I mean by that is there's traditional amounts of radiation that's delivered for a patient, but there's some newer variations of that treatment called hypofractionation, where actually it's more concentrated doses of radiation, but they're delivered in a shorter time period. And what we find is that by combining all these inputs about the socioeconomic and the health disparity components of a patient's clinical picture into the treatment plan, we could say, like, this is actually a hypofractionation, or reducing the amount of time that the patient has to come get treatments and actually spend time, or we refer to it as time toxicity spent on actually treatment itself, can be reduced. So we can reduce time toxicity. And to your point, that's one lever where perhaps we give them a little time back to be able to work or take care of their family, or whether it's childcare, for example, be able to go back and do those activities. So I think being able to communicate what your needs are, what your lifestyle is, where you are at financially, those are things that sometimes get lost in the kind of the role of a patient getting a treatment plan and then proceeding with treatment. And there are things that physicians can do and the system can do to support patients.
As we wrap up here, do you have any specific resources that you would recommend for listeners, either who are going through this treatment or might be caring for someone who is?
I think starting with that, really strengthening that physician-patient relationship is really important. And what I would say is that physicians have, whether their practices or their connections with the community, have a lot of resources that they've been able to vet and look at to then point the patient to in order to be able to address their specific concerns. So I would start there. And then, the next couple of things is, I think there's a lot of public resources. For example, ACS, American Cancer Society, they have a lot of specific resources around patient navigation that they're building out. that are publicly available. And so I think some of the national cancer societies have put out a ton of information and resources that, again, have been vetted by clinicians and navigators and nurses.
Thank you so much for sharing those thoughts. And thank you for joining me today, Dr. Golla. I appreciate your coming on and sharing your expertise.